Of those antibody tests, I wouldn't put any stock in any single result. Why so?
Well, I'd repeat it at least twice, because the tests have a low specificity for a test that's predicting a low probability event, and that low probability event being whether or not you have antibodies. You get a high error rate. You get a high false positive rate that could be as high as 30% with some of these tests, some of the tests that are actually authorized by the FDA.
Say you have a test so good it's 100% sensitive. That means that every time you show it a sample containing antibodies, it recognizes them. And say that same test has a 95% specificity. That means it accurately identifies a sample without antibodies as negative 95% of the time. But 5% of the time, the test wrongly thinks the antibodies are there. That's what's known as a false positive.
Those tests perform better when there's a high prevalence or high incidence of disease.
We can interpret positive test results more reliably when a significant portion of the population has been infected. When only a small portion of the population has had the virus, it's harder to have confidence in your individual results. Let's say 4% of a city's population has actually had COVID and recovered. That's a reasonable estimate for many parts of the country, outside of hotspots. Out of 1,000 people, 40 have recovered from COVID. They test positive and have the antibodies. The rest of the people, 960 of them, don't have the antibodies, so they should get a negative test result, and most will. But remember, 5% of them get a false positive, meaning they get a positive test result, even though they don't have the antibodies. In this scenario, it's actually more likely your positive test is wrong than right. In other words, you're still more likely not to have the antibodies. But all 88 people think they have the antibodies. If they all go back to normal life, more than half will still be at risk of catching and spreading the coronavirus.
But if you repeat the test twice and you have a positive result on 2 tests, that dramatically increases what we call the positive predictive value of the test. It increases the likelihood that that positive result is in fact true.